Thank you so much for taking time to be here with us today. We are talking about specifically the Black maternal health crisis that our country is facing. And so I want to start off just by asking when did you become aware that Black birthing people were facing a crisis in this country?
So Cheyanne, let me tell you, one, I've always known. I think it became more of a prevalent issue or concern, something that I became more passionate about when I was able to join the team at March of Dimes. But just in my own experience as a mom I say little girl, but she's not, she's a big little girl. I had my own complications and they tied into a lot of the things that I have been more educated on and very passionate about here in recent years since joining the March of Dimes team, but also just being a community advocate myself based off of my own personal experiences.
And this is something that I think really stands out to me is just how many Black women, how much we know about it, and then other people are like, well, what are you talking about? So can we just talk maybe a little bit about what the difference is between those who are within the community who have those experience, how that conversation, how do we have that conversation with others who seem unaware? Because it feels like there's so many people who don't know that this is something that people, Black birthing people are facing is, what is it, 3 to 4 times more likely to
Yes,
die.
yes. The, the way you talk about it, and you're right, and it's unfortunate that we have seen that there has been an increase in terms of the number of Black people, Native American people, and also Hispanic mothers who are faced with this challenge, right? And when you talk about it in the Black community, it is making sure that you're educating people and letting them know that this is why we've got to step out. We've got to look at the data that has been recently released and look at the report card, talk about the information that highlights that this is an issue that not only impacts one and two and three families of color, but it impacts us across the nation. It has a direct impact on our healthcare system. It has a direct impact on moms and babies. And, whenever I have the opportunity to talk about this issue, I always phrase it in such a way because you've got a generation or younger people or even people who are not parents yet. I always ask the question, how many of you have a mom? And I think the way you talk about it is you make it real. You help them to understand that we all have moms and that we should be concerned about your mom's health, your mom and what she went through bringing you into this world. And I think when we're able to make this relate to the average individual, we're able to gain traction and go a long way.
And Stacey, I want to ask very quickly, and it's okay if you don't want to, because you mentioned that you had some complications. And so I just want to ask, how is your daughter and how are you after having to experience things that for a lot of people isn't something that they have to even consider? Are you okay? Is your daughter okay? Everything okay?
So the answer to answer that is yes. Daughter is great. I'm okay, but it is about knowing it's where you live. It's being able to have. So I was one of those individuals who had. We talk about this in our maternity care desert report that where you live does matter. So I am fortunate enough that I live in the DMV area, and that's the district. That's the district, Maryland and Virginia, and not Department of Motor Vehicles, but living in the DMV area. So I have access and had access to healthcare and was able to go for the daily visits. But looking at just my background, some of the things that I needed to be able to look at in terms of just preventable health things that could have been put in place. Being able to be the advocate for myself when I went in to give birth to my daughter. I will tell you, I tried to tell the birth went fine, but I think I was being pushed in one direction over another, and that was to look at potentially doing a C-section. It was also after I gave birth to my daughter, who's a healthy little girl or big little girl now. What I'll share with you after that, I dealt with postpartum depression. I went into my doctor when we needed to remove tell me if I'm making it too personal, but I want people to be able to relate to it. And you take someone like me, educated, born in the South, no longer live in rural America, now live in a more urban focused area, have access to healthcare. I go in, I'm able to tell my doctor, well, I'm not necessarily in favor of doing a C-section. I'm pushed towards doing a C-section. Then after this, I come out, I give birth to my daughter. I suffer postpartum depression. I also try to tell my doctor when we're trying to remove the staples or the stitches, that there's this pain and I'm not sure what it is. And she says to me, oh, we can do this now because she says, she does say this, and I quote, we can do this now because you're acting like the baby. Well, long and the short of the story, I let her remove the staples. I leave, and 4 hours later, they have to rush me to the hospital because where they removed the sutures or staples, um, the body opens up and there is a wound that takes place, and my blood pressure shoots extremely high. So then we start talking about issues that face Black women, which is hypertension. Did I have hypertension before my pregnancy, pre-hypertension? No, I did not. Very healthy individual, probably a few pounds, a little bit overweight. But in terms of when we talk about hypertension that impacts various groups of individuals, such as Black women, Hispanic women, and Native Americans. So I faced those things. Had to be put in the hospital and stay away from my child for an additional 3 days. So she was taken home, but remember, I had to return. So I was in the hospital the first 3 days of her life because my doctor didn't listen to me. Now, she did come in and she did apologize and said that she should have paid more attention to what I was saying. She apologized for saying that I was now acting like the baby. Because had she paid attention, she would have realized that there was actually an infection that was causing me to be fearful of her being able to touch me and examine me the proper way. So probably more personal details than what you wanted, but I definitely wanted to highlight when we talk about hypertension, when we talk about pre-hypertension, when you're going through pregnancy, wanted to definitely also highlight it, socioeconomic differences, and also tied into the fact that while I had access to healthcare, there was some bias that was there when I was trying to have the conversation with my healthcare provider about what I was experiencing and why I wanted us not to choose one form of birthing over another, as well as how we were going to go about removing the sutures at that time.
Well, Stacey, thank you for sharing that. I am so outraged on your behalf that somebody would not only ignore what you were saying, but to tell you that you're essentially acting like a
Like the
baby
baby.
because you're in pain. And I think it shakes me a little bit because we always see the statistics about how Black people's pain is dismissed. They're not treated for their pain when they do say it. The sort of implicit bias that, we don't, for some people, don't feel pain. And I just want to take a moment too, because I don't know how I would have handled myself in that situation. And I know right now there's a big push, for instance, to have more care or more funding for doulas, for instance, and
Yes.
having somebody there who can help be that advocate for you. And so I want to take a moment to talk about our medical system and how do we start to address some of these biases that we have in our medical system that are encouraging doctors in some ways to not listen to Black mothers when they are saying, I don't want to do my delivery that way, or I am in pain, or I'm worried something's wrong.
So Cheyanne, let me share what we're doing at March of Dimes. It's through legislation. It's through being vocal in your communities. It's through rolling up your sleeves and being. I tend to say a voice for the voiceless. And it's not to say that these mothers, that these Black moms, that these Native American or these Hispanic moms don't have a voice. But I think when we talk about when we talk about doulas and having doulas be in that space, being vocal about having doulas and getting support at your local, your state, and your federal level. There's legislation that March of Dimes is advocating for right now that every and anybody, mom and dads, your aunts, your uncles, your cousins, can speak up on. And it's legislation that kind of like Congresswoman Lauren Underwood and the Momdibus. And we've heard conversations about Momdibus 2.0, looking at funding for particular bills such as the Stillbirth Act, with Stillbirth Reauthorization Act. And that is being able to put things in place for us to look at and hold doctors accountable. It is also something that March of Dimes is pushing and encouraging and supporting legislation for, but we also do is implicit bias training. It is educating doctors to recognize where we've got those implicit biases, right? So that when you have a mom who is either telling you, or if there is a doula that is there with you, that's helping you go through your birthing experience, to advocate and talk for you are just ways that we're able to address the biases that exist in healthcare and the biases that exist in our hospital system across the board. And so, I naturally transition to the policies that we put in place and how we hold people accountable. But I think the more we do things like your programming here and talk about maternal and infant health and talk about how racism intersects with politics, the better we're going to be able to educate society, educate our leadership, our elected officials on us being able to put measures in place to be able to address those things. So as you can see, I'm very passionate when we start talking about the disparities in maternal and infant health, and we start talking about health equities and how do we close those gaps and how do we start to look for solutions.
No, and I appreciate that because there was when you talk about access and maternity care deserts, and I think in this, correct me if this is from a previous report, but I believe it was more than 2.2 million women of childbearing age living in maternity care deserts.
Mhm.
Can you just talk a little bit about what a maternity care desert is and what challenges that then proposes for childbearing women, and especially how it affects things like our maternal mortality crisis?
Sure. Let me share. So maternity care deserts. And so March of Dimes recently, last month, released the Maternity Care Desert Report. And the Maternity Care Desert Report looks at the lack of access to healthcare. It looks at not only that, it looks at the distance it takes for where you live being able to get to a provider or obstetrician. Those things impact what we know that could be preventable death, right? Looking at maternity care desert review committees. We know that we've got current legislation that's in the House and the Senate to look at being able to continue to fund those maternity mortality review committees. And when you start to look at those committees, it is looking at those review committees. They help establish protocols and policies for review, right? And they look at identifying and developing tools for how we do training, how do we do support. It looks at how many hospitals are close to a population out of maybe 50 or less or greater rural areas. How long does it take for you in those maternity care desert areas to get in to see a practitioner? We know that in rural America, and I grew up in rural America, I grew up in rural South Carolina, and you sometimes would have to travel 45 to 50 miles just to be able to get in to see an obstetrician, an OBGYN, a nurse practitioner, anyone that could help you make sure that you're going through and having a healthy baby. So the maternity care desert report also shows, it looks at the conditions. It looks at the distance. It looks at when we talk about healthcare and we talk about access, one, being able to make sure that you've got the access to it, but you also have to take into consideration where you live and why it does matter. And so what we do know from, the data that we've recently released, and we've done the maternity care desert report, and we just released the nation's report card. And so what we know is that the United States is one of the most well-developed nations, industrial nations in the world. And yet we're getting a D. So it shows that there's so much more that can be done.
One of the things that I think you kind of touched on too is that this crisis is it pushes socioeconomic boundaries. So you could be living with, your higher education degree and still face increased challenges, that you're still facing potential death. What is that telling us about the way systemic racism is just playing into this issue here in and of itself?
It tells us that we've got more work to do. It tells us that we've got to focus on mental, maternal health. It tells us that we've got to focus on implicit bias training. It tells us that we've got to continue to look for solutions and address it through policies um, that are going to hold hospitals, that are going to hold doctors, that are going to hold practitioners accountable. I mean, I wanted to highlight as we're having our conversation is that, do you know 4 out of 5 deaths are preventable? And that's according to the 2017-2019 data from 36 of the maternal mortality review committees. So there's work. What it tells me is that there's a lot of work. And so it's being highlighted from the switch up that we're doing here to the work that other organizations and our organization is leading in that space in terms of education, research, and advocacy.
I'm so happy that you brought up that statistic, because I think that was, when you hear just how many of these deaths are preventable, I think it sort of shakes you a little bit more to know that there's no reason for these people to be dying. There is no reason for somebody in this country, for the most part, to be dying because they are pregnant or because they are giving birth. And so um do we have information on what some of these causes of death are that are preventable?
So yes, we do. And we're continuing to do the research in terms of what you look at and what is preventable. I think we start to look at hypertension is one. We start to look at not only hypertension, we start to look at what some of the mental impacts are. We look at some of the social economic drivers that also have, excuse me, that also have a direct impact on our mothers and on our infants and the health that's being provided and taken care of. What we know is that the infant mortality rate among babies born to Black birthing people is 1.4 times higher in states than it is for Black women and Native American women than it is for white mothers. So that's an overall increase. So we're looking at inadequate prenatal care by race and ethnicity. The highest percentage is 22.4% for Black moms, and it's 27.7% for Native Americans. And that's compared to the overall 14.9% of inadequate care.
Stacey, you're so good at taking me right to where I want to go, because the next question I was going to talk about is the fact that this mortality crisis is actually affecting newborns. It's affecting infants at this point in time, where we are seeing, I think, is it Black infants are 2 times more likely to die within their first year than white infants. Um,
Yes.
do we have information as to why this specific demographic of babies are more at risk of dying.
It's access, it's location, it is making sure that we're able to take care of the mom as she's going through the pregnancy journey. It is an increase of these premature births, and also babies that deaths that are preventable deaths. Um, it's a lot relying on it's on society. It's on being able to set the parameters and look at where we are. We've got some data that I'll have to send over to you that goes into depth in our recently released report card that can give you a little bit more statistical answers to your question as it relates to that.
One of the things that we are seeing a push for from advocacy organizations, but also from some of our political leaders who are, I think about, as you were saying, with Congresswoman Lauren Underwood, or Congresswoman Robin Kelly, who we
Right.
also interviewed for this episode, is a push for more midwives and doulas, and access for birthing people to be able to connect with those individuals. Can we just talk a little bit about why midwives and doulas can help address this crisis that we are seeing?
So Cheyanne, let me also say we've worked, and I mentioned Congresswoman Underwood, but we have been working very closely with Congresswoman Robin Kelly. Recently, the House passed, and we're very excited about it, the Premier Reauthorization Act, and that was led by Congresswoman Eshoo. And so just wanted to highlight the work that is being done in the space as we address the Premier Act. Our hope and prayer, it was unanimously passed, bipartisan support coming out of the House on last week. We're excited about it. I will tell you, we've still, our fingers are crossed that we'll get it and we'll get it passed in the Senate when the House and the Senate come back in session. Uh, when Congresswoman Underwood and Robin Kelly and all of our champions and all of our partners at the congressional level, excuse me, are advocating for more doulas and more midwives. We're working in that space because we believe that having a doula or a midwife to be able to help a family, help a mom, help a birthing person go through their pregnancy, their pregnancy delivery, correction, being able to be there, to be the advocate, to explain to them what is expected, what you're going to experience, being able to have someone outside of yourself when you say, I'm not sure that I want to have a C-section, or these are the things that my body is telling me that I'm having these pains, I'm having these terrible headaches. You having someone who's a doula that can help you, that's there, having a midwife, it changes your whole overall birthing experience. I've had the opportunity working at March of Dimes and being in this role to sit with community leaders, be a part of panels, and hear stories. And one moving story was there was a woman who now has become and has going through one of our doula training programs, and has gone through a doula training program that we have partnered with. Her story just a few weeks ago was based off of her experience. And she went through a stillbirth. And then she and her family wanted to try again. She was able to give birth to two children, a boy and a girl. And she said her experience from going through having a stillbirth was what she wanted to advocate for, what she wanted to talk about. She didn't feel comfortable talking about herself. Becoming a doula, being present, and being with a new, I won't say patient, but a new mother, who was a young new mother, a young Black mother. I want to say probably, I think she said maybe 19 or 20 years old, letting her know what she was experiencing, making her feel more comfortable about her experience, being able to speak up for her. And at one point she told and shared the story of the doctor not wanting her to be in the room and how she was talking down to this young lady and how she was able to say, no, we're not going to have that. And I am going in the room. And this is what I know from my own personal experience. So having doulas and midwives, and what Congresswoman Underwood and Congresswoman Kelly, and Congresswoman Adams and Eshoo and all are advocating in that space of maternal and infant health is that having doulas and having midwives be present changes the experience, helps you with your delivery and your process. And you should also know, not only do I focus on federal legislation, but we also focus on states. And there are states that are starting to look at how do you support through state funding, through Medicaid expansion, being able to fund and pay for doula or midwiferys and being able to have coverage there. So long answer, but the short answer is definitely something that we need to be able to support, and having those members of Congress being our champions and working with them is helping to move the needle, because then it makes that experience a much better experience for those mothers, whether they're young, old, or not, to be viewed differently, but being able to have a voice in the room.
And Stacey, I want to ask too, and it's okay if this is not maybe something March of Dimes comments on, I'm not positive, but um um I think in a lot of ways we are still dealing with the fallout of the Dobbs decision overturning Roe v. Wade and access to reproductive choices such as abortion. Do we know just yet how that is going to affect our maternity mortality crisis just yet if women don't have access to abortions?
So so we have not, here's March of Dimes. We are concerned that restricting access to legal abortions will not reduce the number of abortions. In fact, research shows that it's high likelihood that this will increase rates of unsafe abortions and have a negative impact on maternal and infant death rates. March of Dimes, we're continuing to look at the access to state maternal health care, and we're going to look at the reports and look at the data to kind of look at what the impact is to the decision of overturning Roe versus Wade. We're still strong. We're strong advocates for protecting the health of moms, women, babies. And so our support is just wanting to guarantee that all women have quality, affordable health insurance and health care. And we're doing that by focusing on expanding Medicaid for individuals who fall at or below the 138% of the federal poverty line. So we're looking at accelerating policies and programs so that we can look at how do we give supportive care for women during their pregnancy.
Mhm. No, I appreciate that. And I do want to be conscious of your time. And so I want us to, and we covered so much today and, looking at our elected officials, looking at our medical system, who does the onus have to be on to address this crisis that Black birthing people, Indigenous birthing people, Hispanic birthing people are facing? Is it on our legislators? Is it our medical system? Is it the communities themselves? Where do we have to put this responsibility?
Cheyanne, that's a tough question, but a good question, a very important question. And my answer to you, and for people who are listening, is that we've got to put the onus on all of us. I mean, I think it's going to take all of us doing our part to be able to change it. I think we've got to educate our community and people who don't look like me, to know why this is important, why what happens impacts all of us. And so it's so important that we don't say that it's just on the healthcare system or our healthcare providers. I think that we don't just lay it at the feet of our legislators alone. And the reason that I say that, we've got to use, as my grandmother would say, sometimes you got to be able to thread the needle. And once you've thread the needle, you use the needle to be able to change the outcome. And what does that mean when I say it takes all of us? It's going to take the community holding our practitioners accountable. It's going to take the community educating the community for people who don't look like people of color, who are suffering at a higher rate, but letting them know and helping educate them on the impact that it has on all of us as a country, all of us as a society, all of us as a nation. And then as you continue to thread that needle, it's going to take the advocates holding our elected officials accountable to put policies in place, to be able to get research done, to be able to educate, but also to hold the healthcare systems and our healthcare providers accountable. So it's definitely threading a needle because it touches all of us. And that's how you're able to bring it all together. So the answer is, my takeaway from this is, it's going to take all of us. And if it has a direct impact on you, it does. You may say, well, no, I'm not the birthing person, or it's only affecting this part of society. But in the end, the reason that I always ask the question, and I hope that people take this to heart, it is, do you have a mom? If your concern is healthcare, we talk about the rising cost of healthcare. All of these things contribute to something that is directly going to impact you, whether you are the birthing person or not. So it's going to take all of us. I lay it squarely at the feet of everybody in society as a whole, but understanding, as my grandmother says, it's going to take all of us to thread the needle. And once you've thread the needle, we've got to wove it all together so that we'll be able to change the impact. And we'll be able to change that report card, that the report card status of a D that the US has now currently. And I think together we'll be able to do that, but it's going to take hard work. It's going to take education. It's going to take advocacy, and it's going to take all of us. And having an open dialogue about race, the impact, and also about race and politics across the board.
Stacey, thank you so, so much for your time. We so appreciate you. I just, this is such an important conversation. And I think there's starting to be a little bit more attention placed on what is happening right now to birthing people. And I think it's so important. But as you mentioned, there's still so much work that we have left to do. So I just appreciate you taking this time to talk about what some of that work will have to look like.
So Cheyanne, I thank you for the opportunity to be able to join you on this podcast. I will tell you, we start by doing things like what you're doing here now, what the Hill is doing here now. It is having the conversation, bringing the voices in, making sure people know that they have the ability to thread the needle and bring about the change. And this is a bipartisan issue, right? It's a health, maternal health and infant health is bipartisan. It doesn't belong to one party or another. It is, we're going to need everybody to be able to address it. So thank you for hosting this, and thank you for allowing me and allowing March of Dimes to be able to participate, because as you can hear and probably see in my face, I'm very passionate about this. And I think it's something we've got to be able to continue to ring the alarm on. We're making progress. And so you have to have it like a drum beat, slow, steady, but continuing the pace. So thank you.
Thank you.